You always see in the movies, right? Like when the patient's wheeled in, it's all, get me the ECMO, stat. It's like this miracle solution. Well, today, we're diving deep into ECMO, what it is, how it's used, especially for adults struggling to breathe. We've got a stack of your research here, so get ready to become an ECMO whiz.
Yeah, and I think a lot of people would be surprised to learn that ECMO's not exactly brand new.
Oh, really? I just thought it was like this cutting-edge thing. Tell me more.
Well, think about it. In a way, it's got these roots going all the way back to those heart-lung machines they use in open heart surgery.
Oh, right. To keep the blood flowing while they're...
Exactly, keeping that blood oxygenated and moving while the surgeons do their thing.
Okay, so it's like a temporary support system.
Exactly.
And speaking of support, one of these articles you sent, this ECMO, Adults BJA Tunnel 11, it explains how ECMO basically gives a patient's own heart and lungs a break, like
Yeah.
when they just can't keep up.
You got it. Think of it like a backup generator kicking in when the power goes out.
Ooh, I like that analogy.
Right. So it just kind of takes over when the primary system's overwhelmed.
Okay, that makes total sense. Now, we have to get into these different types of ECMO, because this is where I always feel like I'm like suddenly in an episode of Grey's Anatomy. So here.
Well, all right then. Let's break it down. Let's start with the most, I guess you could say the most comprehensive type. We call that VA-ECMO. It stands for veno-arterial.
Veno-arterial. Okay, got it. And what makes that one the most?
So VA-ECMO, it provides both gas exchange, getting that oxygen in and CO2 out, and it also provides circulatory support. So it's really like a total heart and lung bypass.
Wow, the whole shebang. So if your heart and lungs are both...
Exactly. It's like hitting the reset button, giving them a chance to rest and recover.
Okay, that's pretty intense. What about the other types?
Right. So then we've got VV-ECMO, which is veno-venous.
Veno-venous.
This one is all about giving those lungs a break. It handles the gas exchange, pulling out the CO2, adding the oxygen.
Right.
But it lets the heart keep doing its thing.
Oh, so it's like specialized lung support.
Yeah, precise.
Okay, and I saw there's a third kind AV-ECMO, right?
Ah, yes, arterio-venous. That one's the simplest of the bunch, mostly focused on getting rid of that CO2 from the blood.
So still important, but...
Oh, absolutely. But it needs the patient to have a heart that's still working decently well on its own. It's more of a CO2 assist than a complete takeover.
Gotcha. 3 types of ECMO, each with its own, specialty.
Yeah.
But how does it work? I mean, for those of us who didn't go to med school.
Tuckles. Right. Well, it all starts with something called cannulae. Basically, they're these tubes, and they get inserted into specific veins and arteries.
So it depends on which type of ECMO they're using, where these tubes go.
Exactly. It's all about creating the right pathway for the blood flow.
Like pipelines.
Exactly. So the blood gets drawn out through these cannulae and then pumped through this device called a membrane oxygenator.
Membrane oxygenator. Sounds intense.
It's pretty amazing. Think of it as like an external set of lungs, basically. It adds the oxygen to the blood, removes the CO2. It's really quite something.
So it's doing what our lungs should be doing.
Exactly. And then right before that oxygen-rich blood goes back to the body, it passes through this warming system.
Oh, why is that?
Well, got to make sure the blood goes back in at the right temperature, right? Keeps everything balanced inside.
Makes sense. It's incredible how they've figured out how to, mimic these natural processes.
It's really remarkable.
Okay, so we've got the basics of ECMO down. But you said this other article, Evadrew 22000 or 128.pdf, it's all about using ECMO for something called ARDS.
Right, and that's a whole other...
Yeah, fill me in. What is ARDS?
So ARDS, it stands for Acute Respiratory Distress Syndrome. Basically, it's this severe lung condition, and sometimes, even when they put someone on a ventilator...
It's not enough.
Sometimes not even close. It can be really scary.
And I was reading that ventilators themselves, I mean, obviously they're there to help, but they can sometimes even make lung injuries worse.
It's a delicate balance, for sure. Doctors are always walking that line between providing support and potentially causing more harm.
That's a tough spot to be in, so that's where ECMO comes in.
Exactly. When ventilators aren't enough or they might be doing more harm than good, that's when ECMO can be a game changer.
Like a last resort, but in a good way.
Yeah, you could say that. It gives the lungs a fighting chance, allows them to rest and heal while still making sure the body gets the oxygen it desperately needs.
Wow. And there was something about ultra-lung protective ventilation. That sounds pretty high-tech.
It is. Because ECMO is doing the heavy lifting, the doctors can actually use gentler ventilation settings.
Oh, so it's gentler on the lungs because...
Exactly. It minimizes that risk of further injury from the ventilator itself.
Okay, so ECMO, it's like giving those lungs a break and a fighting chance all at the same time.
Precisely.
And you mentioned some studies, CSAR and ELA. What did those look at?
Those were landmark trials. They really dove deep into how effective ECMO really is for AVs.
What did they find?
Well, one of the big takeaways, especially from that EOLA trial, was that using ECMO early on for severe AOA deaths, it significantly increased the chances of survival, way more so than using just conventional ventilation.
That's amazing. So it's like a beacon of hope in these really dire situations.
Exactly. It's not a guaranteed win every time, of course, but it's a powerful tool to have in the fight.
Absolutely. And speaking of fighting, didn't the COVID-19 pandemic really bring ECMO into the spotlight?
Oh, absolutely. It was everywhere in the news.
Yeah, it seemed like all of a sudden...
It went from this, somewhat obscure treatment to being discussed everywhere.
It's like the go-to.
Well, for those severe COVID cases, those really tough ARDS cases, it really was. ECMO was often the only hope.
Wow. It really shows you the impact, right? When a technology like that is.
It's true. ECMO's been around, but the pandemic, it really highlighted just how vital it can be.
It really puts things in perspective.
It does.
But I think it's easy to get caught up in the headlines, and not really think about what it all means for, like, the average person.
Absolutely.
So let's bring it back down to earth for a second. We've talked about what ECMO is, how it works.
Right.
But when is it actually an option? Like, who gets ECMO, and how do they even decide that?
That's such a good question. And the first thing to emphasize is that ECMO, it's not for everyone.
Right. It sounds pretty intense.
It is. It takes a lot of resources. There are risks involved. So patient selection, it's really important.
So how do doctors decide? Like, what goes into that decision?
Well, they have to look at a lot of different things. First of all, how sick is the patient? Is it a life or death situation?
Right.
Have other treatments failed? And then they have to look at the patient's overall health. Do they have other conditions?
That might make it riskier.
Exactly. It's all about weighing those potential benefits against the potential downsides.
Right, because there are always risks.
Always. And with ECMO, those risks can include things like bleeding, infection, blood clots.
That's serious stuff.
It is. It's a complex procedure, and with that complexity comes risk. It's just the reality.
And the research mentioned neurological problems, like brain stuff.
Yeah. It's not as common, but it can happen. ECMO, it affects blood flow, right?
Right.
And sometimes they can lead to inflammation, and that inflammation can sometimes cause problems with the nervous system.
Wow, so it's a lot to consider.
It is. And that's why open communication between the doctors, the patient, and the family is so, so important.
They have to be on the same page.
Absolutely. And, it's not like ECMO's this simple thing. It's not like plugging in a lamp.
Oh, I bet.
It takes specialized equipment, training, constant monitoring.
It's like a whole team effort.
Exactly. It takes a village.
So let's say someone goes on ECMO and everything goes well. What happens after? What's the recovery like?
That's the million-dollar question, isn't it? And honestly, there's still a lot we're learning about the long-term effects of ECMO.
Really? So they don't really know?
Well, we're getting there. Research is ongoing. Every year, we understand more and more.
So for now, it's kind of wait and see.
To some extent, yes. But the good news is the early studies, they're actually quite promising.
Oh, that's good to hear.
A lot of ECMO survivors, they go on to have a really good quality of life. Of course, it varies, depending on how sick they were initially, if there are any complications.
Right. Everyone's different.
Exactly. But overall, it's encouraging.
That's good to hear. So it's like this new frontier almost.
It kind of is. We're still figuring it all out as we go.
Which is why these deep dives are so important, I think.
I agree.
Because it's about giving people the information they need, the knowledge.
Empowering them.
Exactly. To understand not just what ECMO is, but also, why it matters, what it means for the future.
It's about having those informed conversations, asking the right questions.
Absolutely. It really is, isn't it, when you think about it?
It's amazing, really.
Well, I feel like we've covered a lot of ground here.
They have. From those, early days of heart-lung machines.
Right. It's come a long way.
All the way to, these life or death situations in the ICU.
It's pretty heavy stuff.
It is. But that's the thing about medicine, right?
And always evolving.
Exactly. And ECMO, it's a perfect example of that.
It makes you think, though, about the people behind it all, The doctors, the nurses.
The research.
Right. All those people working to make this technology better, to save lives. pretty incredible.
It really is. And for the patients, for their families.
It's got to be a roller coaster.
I can't even imagine.
So, as we wrap things up here, I want to leave our listeners with a little something to think about.
Okay.
Knowing what you know now about ECMO, all its potential, but also all the risks, all the decisions.
Right.
What's the biggest takeaway for you? What really stuck with you?
That's a tough one. I think for me, it's just, how far we've come and how much we still have to learn.
That's a good way to put it.
It's a journey, and ECMO, it's a part of that journey now.
Absolutely. Well, to all our listeners out there, thank you for joining us for this deep dive into ECMO. We hope you learned a lot. And until next time, keep asking those questions. Keep seeking out that knowledge. It's out there.
And it matters.
Yeah, it really does.